Well, welcome back to season 3 of Level Up Infection Prevention Podcast. I'm Michelle Strange, and I'm so excited to have you join me as we dive deeper into the nuances of infection prevention and patient safety. Today, we're tackling waste management. I don't know, you're all like, "What?" Get excited, y'all. It's gonna be helpful, I promise, because it is a topic that's so important to creating safe dental visits, and I'm thrilled to be joined by Lisa Kane, who brings a wealth of knowledge and very practical insights, I think, to the table. Welcome to the podcast.
Thank you so much for having me. I'm so excited.
Yeah, no, okay, I'm gonna tell you, and I'll be transparent to the audience, this is the topic in infection control that I know the least about. I'd like to say it was because it's very, like, state and county dependent, and since I was traveling, I just didn't learn it. But if I'm just realistic, I just didn't want to.
Because it was gross. Is that why?
No, it's just, I think it was what all of our people you do a lot of consulting and work with offices. I'm sure you interact with people that just have that analysis paralysis, and it was like it felt like a big topic. I'm sure you're probably gonna make it so simple. I'm gonna be like, "Why was I fighting this?" But I think that was mostly it. It just felt like a big topic, and I just didn't wanna do it.
Yeah, you make me a little nervous because I feel like it
Oh,
is pretty easy. Um,
no, that's what
so
I'm pretty sure it is easy, and
yep.
I have made it more complicated. So where
So,
would we start? What are some of the big things that you find when you're in these offices and that we need to probably be mindful of?
so I think the big thing is differentiating what waste is, right? Different
Uh,
kinds of waste. So a big thing I see is biohazard stickers on things that are not biohazard. So regular trash, something that has a little bit of blood on it, a little bit of saliva on it, not biohazard, not regulated, regular trash, right? So most of your PPE, unless you have a really procedure
yeah,
on
let's hope
that,
that we don't have much of that.
right? So like everything is so regular trash, you do what you want. Obviously related to like privacy stuff and shredding and that kind of stuff, that's a different story. But like as far as clinical trash, something that does not have a lot of blood or saliva on it is regular. So I see a lot of people putting biohazard stickers all over the place. And you don't like, there's no reason that there should ever be a biohazard sticker on the trash can in the kitchen.
Do you think they're just trying to cover themselves? They're like, I
Okay.
don't know what to do, so I'll just put it everywhere.
Yeah, I mean, there's a lot of labeling requirements, right? And no one kind of knows what they're supposed to be labeling. So I do think that 100%, right? Everyone's trying to make sure they're doing the right thing. But, if you have a biohazard sticker on it, you have to treat it as regulated waste, right? Otherwise, like maybe some people are putting stuff in there and some people aren't. So, you don't really know what's in there. So you have to treat it the right way.
Yeah.
So
Okay.
something that is regulated or, biomedical waste is something that you would squeeze and either blood or saliva would come out of it or something sharp.
Okay.
The definition of it, right? So it's blood soaked gauze, supposedly saliva soaked gauze, needle. I think carpules that you use that you aspirate, I think those are, medical waste. I don't think carpules that you not use, I go in a lot of offices and they have expired carpules. Those are not, they're not biohazard waste.
Where do you put those? Because I think that is a very common thing is like, well, okay, so if you aspirate blood, does that go into the sharps container now?
Yeah, I think if you aspirate, if you use it on a patient, you hope you're aspirating for everything, right? So like that's sharps container. If it's just that it's expired, this is where you have to go by your state. But most
Okay.
states, it's regular trash. So epinephrine, if it's an epinephrine salt, which most of those are, it's regular trash. You can dispose of it according to that. If
Okay.
it's not, then you check with your state and see if there's another way to do it. But yeah, if it's used on a patient, if you have a needle stuck in it, I think it goes in the biohazard
Okay. And
container.
that biohazard would be sharps specifically?
Yeah. So this is also where it gets weird. Some
Yeah.
companies I've called companies and they say that they treat all biohazards the same, whether or not it's gauze or whether or not it's a tooth or it's a needle. It's all sort of whatever they do in the disposal world and how they condense it and whatever they do.
Okay.
Um, they treat it all the same. somebody did recently tell me that their company said, no, separate out needles from gauze stuff. So just confirm with whoever is your waste company,
Okay.
what you're doing and how to, what they want you to do. But I do think
Okay.
most don't differentiate.
Okay. All right. That's good to know. I know that gets all very confusing. And now that I started in South Carolina, I live in Colorado, like it feels like there might be some differences there. So
Yeah.
the state regulations, because your state and county kind of trump bigger regulations, right?
Yes.
Ish.
It's, I mean, so some states and you require, like I'm in Massachusetts. Massachusetts requires whatever the CDC and OSHA say you got to do, no choice, right? So then you
Sure.
listen to that. But, things like lead aprons, right? There's a whole thing about lead apron and
Yeah.
people say one thing and other people say another thing, but your state does trump that, right? So it's
Yes.
whatever your state says. So it's different situations. You kind of have to read your board regulations and see what it says. And, is it the Department of Environmental Protection, like who's dealing with who's making the rules and in the laws, what they're requiring, who they're telling you to
Okay.
follow.
Okay. So we're seeing a lot of people put biohazard stickers where they probably don't need. They're not
Yep.
properly separating it. What else do we often see?
You know what I see a lot of, which is a little bit off topic, but it's waste.
Yeah.
Controlled substances being
Oh.
disposed
Mhm.
of, like having like a little bit extra, like ketamine or something, right? And either squirting it into the biohazard box or squirting it into the sink or squirting it into the trash. You can't
Right.
do that. You have
Yeah.
so like I'm on a big controlled substance kick and logs and all that kind of stuff. Like that's what I'm really
Mhm.
coming to right now. But you have to dispose of those properly. And the easiest way to do it is in something that looks like a sharp container that you squirt the extra controlled substance into that. You have to log it on a form 222. You have to it makes it inactive and you don't use it. But waste like that, controlled substance waste has to be done in a certain way. You cannot just squirt it in a sharps container. There have been cases and situations where people have gone into sharps containers because they're looking for medication.
Oh my gosh. Yeah. Okay. And you know what's so funny? In my head, I'm going like, obviously this makes sense, but I think I was very lucky that I worked in a office. I did a lot of IV sedation, a lot of oral sedation, and we had a nurse that came from a hospital
Yes.
situation, and she
Mhm.
was very specific. So
Yep.
I remember helping her count, helping her dispose, helping her document. She was very particular about her documentation. But I guess I'm just lucky I had that exposure and
Yeah, I
didn't
think that's
realize that it was an issue.
unfortunately no, unfortunately, I think that's kind of rare. I think that everyone, you
Oh,
get so
wow.
focused on dentistry and it seems like, why am I doing all these logs and why am I doing all these things? I mean, there's two different perspectives, right? You're doing it because you want to be safe and make, not have extra drugs going around and not have
Sure.
diversion and that kind of stuff. But then there's the other part of it. You could be charged hundreds of thousands of dollars by the DEA if they find out that you're doing it wrong, right? You have to make sure that controlled substance waste goes in controlled substance waste.
And in this season of the podcast, like I think you're going to hear so many guests talk about logs and protocols and systems and how if you just get ahead of it, you're
Yeah.
saving yourself a ton of money. And I
Yeah.
think a lot of times people are like, it costs so much money. This is just so annoying, like frustrating. Like the perception is that this is a burden because they haven't been exposed to the problem. They haven't gotten caught, they haven't had an issue.
Yep.
But the burden is when you get $100,000, like, fine coming at
Yeah.
you.
Yeah. You
It
need
is scary.
Yeah. So obviously record keeping from the, controlled substance stuff. But then also when you do have biohazard in your office, you need to keep the records of it going to whoever's taking care of it. Right. And then you need shipping papers and you need like an acknowledgement that they're going to incinerate it. There are other options. You can do like in office things. They have these sort of, again, sharps container looking things that you squirt or put the stuff in, right? You don't squirt it in, you just throw all your biohazard in there and then when it's full, you pour in this other solution and it kind of turns it into a rock,
I
right?
have worked with that before,
Yeah.
yes.
So that is fine too. But there's in office, biohazard, debiohazarding,
Yeah.
debiohazarding. That's a word, right?
I will
Um,
make it up now.
yeah,
I think that
okay.
works.
Yeah, so there's in-office record keeping you have to do for that. So you need documentation regardless of how you're handling your waste, how you're doing it. Obviously, you need plans and protocols, and like everybody has to know how they're counting sharps, where the sharps containers are, what they put in it, what they don't put in it. And then you need records of once it's out of your hands or once you make it non-biohazard, how you're doing that.
Okay. Can I ask you some other questions? And I'm just curious if these things are
Maybe.
common these days. I know. So the other thing, so I use the sharps, pour in the solutions, it hardens it like a rock. You had to weigh it to make sure you weren't going over like, I don't know, the 50-pound mark or something like that. But then you just disposed of it. And then I did work in a practice where we autoclaved the sharps container. Have you ever heard of that?
No, I've
Maybe
heard of
that's a South Carolina
incinerators.
thing. Maybe
So
that's a
there's
South Carolina thing.
incinerators. I've not heard of autoclaving.
So we had the bond, it would go in there. We had to document and log everything. Like, so we had to put numbers on it, the date it was sterilized, the temperature. We had to put all the things on it. And then we had to double bag it
Okay.
and then we could toss it in the trash.
Okay. Yeah, I've never
This
heard of
was
that, but
also
maybe
15 years ago. So definitely check. It might be an old
yeah.
thing that no longer is something that we're allowed to do. But I always found that one interesting because I don't know, that just blew my mind because I was like, "How do we know it's like, we don't have a chemical indicator on the inside. We
Right,
don't
that's the
how do we
thing
know that
too.
it penetrated it?" But, back then, I didn't know what I didn't know when it came to autoclaves
Right.
and sterilization and stuff, so I always found that wild, so I would definitely discourage you with that
No,
one.
I mean, right now, I feel like all the sharps containers would melt, but
Oh, that's a good point too.
right? But
Mhm.
also too, like, you think of it, it's so packed in there, like, I can't
Yeah,
imagine that the stuff in the middle is getting,
I
you
know,
know,
which makes me scared.
sterilized. Yeah, so
Scared.
I would not
Do
if you're
anything
doing
like that.
that, maybe think of another option.
I agree. I think that's fair. And then we also autoclave post-surgery all the bloody gauze so that we could throw it away.
So, as I said, most places did you like the non-judgment face? That was good, right?
No, please, I give all the judgment because these are things
Okay.
that I'm like, I think back on. You probably do this in your career too. I'm like
Mhm.
25 years in this. I think like, oh my God, the things I used to do
Yeah.
before I had no
Mhm.
clue.
Right. I mean, we could go on, but yeah. Um, I feel like so you want to get rid of that biohazard and those sharps as soon as you possibly can. You don't
Yeah.
want to be messing around with sticking things in bags, autoclaving it, finagling with them, right? So if how you're treating it, if they're treating everything the same, you can just put some people have like a little red bag that they have during a procedure that
Yeah.
they know is going to be
Mhm.
bloody, right? And they'll just like, as they do it, just throw stuff in there. You can put stuff in the sharps containers. The couple things about that is like sometimes it's smelly. Also, want to
Oh,
be careful
mhm.
if you're putting your hand near the sharps container because a lot of times people it's hard it is overflowed. I mean, you're not supposed to have it past the fill line, but a lot of
Yeah.
offices, it is past the fill line, so you do wanna be
Yeah.
careful about that. The other thing that
Or
I was
they
thinking
didn't shake it and it like built up on one side a
yeah,
little
yeah,
bit.
yeah, yeah.
Yeah.
Especially, like, opposite, like, endo files are always, like, sticking up and stuff.
Oh, yeah.
But the other thing too that does not go in there is teeth that have amalgam.
Yes. Okay.
So
Mhm.
those have to be in a separate amalgam container, and some states, like New York State, crazily, no offense to New York, wants you to have an amalgam container that's dated that only lasts for a year. Other
Okay.
states kind of you can have an amalgam container and you just when it's full, you give it back to,
Yeah. I was
whatever
gonna say, I
company.
think that's what we do. Yeah.
Yeah, but for some reason, New York State only allows you to have it there for a year. But anything amalgam, if you were going to clean your traps and there were
Mhm.
big chunks of amalgam in there, that would go in the amalgam waste that doesn't go in the biohazard.
And now the one that I picture at the office is kind of just a small container. So they get bigger so that you could put a trap in there.
Yeah, so some companies that do medical waste also will do an amalgam waste, and sometimes you get like this big bin
Mhm.
that people usually have like in their closet where the amalgam separator is for some reason or under the sink and steri, and
Yeah.
it's and they just shove the stuff in there. So you don't have to
Okay.
necessarily put that like you could take the trap and pour it out and put it in the smaller thing. It depends. You'd have to obviously get a size appropriate. And then
Yeah.
that container should have on it, you know, biohazard. And that container should also have on it, it should say if it's a container that doesn't say amalgam on it, it should say amalgam on it with the proper GHS symbols and all the other stuff that it needs.
Okay. And in this season, we chatted with Amanda Hill and we were talking about amalgam separators. And I thought it would be a smarter flow for after an amalgam procedure to change that trap right away, just to get it out and be done with it. What do you think about
Yeah, I
that?
mean, it kind of depends because a lot of it's not necessarily the amalgam procedures, it's a lot of drilling out the amalgams from
Yeah.
other things. So it
Yeah.
kind of
Yeah.
depends what your day's like, right? I guess if you were doing,
Multiple
you
of
know,
those in the day.
right. I mean, I think it's fair. A lot of people just kind of do the trap at the end of the day or when it starts getting, the suction starts to get bad. Um, like it doesn't stress me out as much as having the amalgam hanging out in the trap the whole day because the most people you're probably drilling up some sort of amalgam. I feel like.
I mean, at this point, because my thought in the conversation that we had was like, let's say Thursday, I did the amalgam like procedure, or somebody did the amalgam
Mhm.
procedure. And on Monday, now I'm going to go, get the trap out. But I didn't realize y'all did amalgam and I didn't pay enough attention. So I was
And
like, oh, then it gets tossed into the trash and like just being more diligent about removing the trap after a day. That seems fair. Like a day of
yeah,
procedures. Like we did amalgam today. Like we're going to get rid of this.
yeah, and obviously, like amalgam's pretty noticeable of what it is,
Yeah.
right? You're
Yeah.
gonna see pieces in there that you can put into the amalgam container.
Nice. Okay. So that's a good one. What are our other thoughts on this? Like, where are we missing with our compliance on waste?
I think the documentation
Mm,
is, like you said, is a
Well,
big thing,
that's
right?
across the board everywhere in dentistry.
Yeah. And then being like, as far as where waste containers are placed, I see a lot of people have them like weird places, like you have to almost do like gymnastics to go and grab, reach it. Like, or they'll be sort of, there's not a lot of room on the counter. So they'll have like their sharps container almost sticking out. So I think just be really thoughtful about where your sharp and your biohazard waste is and make sure it's a safe place for you and make sure you can see the top of it, right? Because you need to be able to
Mm-hmm.
see that it hasn't overflowed. And then the other thing about biohazard stickers and labels and that kind of stuff is like if you have under the sink or something where most people seem to have a sharps container, you need to have a biohazard sticker um, on the outside of the container because you want to like warn everyone
Yeah.
biohazard is coming. And then when you
Yeah.
transport it, you got to make sure that you lock it. All the biohazard, containers are locked. You lock it, do it with proper PPE, you're doing it the right way. I do sometimes see, as I'm saying this, I sometimes have seen like people, they'll have like they don't like the little hole on the sharps container. So they'll like take off the whole cap or something,
Oh,
so that it's easier to
Lord.
dump stuff in there. So that's not cool.
No.
Um,
Oh my
yeah.
gosh. No.
You
Wild.
gotta leave there's a reason that they're made like that and they're kind of made like annoyingly, but you have to keep them intact. You don't want to be messing with them. You're not going to be opening up that thing, that cap ever. That's just asking to be poked with something.
Yeah. No, that makes a ton of sense. With the sharps container in the rooms, with OSHA, we definitely know, like, it should be at point of use,
Yep.
correct? And
Yeah.
what are the guidance around, like, location of those sharps containers?
So it's a little like wishy-washy. I mean, it should be a point of use, easily accessible. Some offices have them in steri, right? Some offices don't have them in the operatory. Like if you have it in the operatory, it should be easily accessible and sort of at eye level. If you're using the closable, stampable carrying container you're supposed to use from the
Mhm.
operatory to steri, and you put all your sharps in there and you're carrying it safely, like I'm almost okay with you having your main
Okay, that
sharps
makes
container in
sense.
steri, right?
Mhm.
But if you're haphazard and, you know, not having things how they need to be, or there's chances that someone's going to get stabbed, definitely have them in the operatory. And it is not a bad idea for the provider that's doing the actual injection to dismantle it. I mean, that's
Mhm.
kind of ideal if you can
Mhm.
get the person to do that.
Yeah. And, you brought up, like, being able to see the top of the sharps container, which is actually something that just I wouldn't say just, maybe last year it happened, but we had a sharps container in the sterilization area that was just slightly up,
Yeah.
and I'm 5'10", 6'3" on my best day with best posture. So, like, everybody else is tall in the office. So that was fine for them, but not for me.
Yep.
And I actually ended up getting poked, but with a clean needle because we were actually demoing potential ones for the year, like the annual ones. Like,
Okay. Yeah.
what
Yeah.
do you
Yeah.
think about this? What do you think about this
Yeah.
shark safety thing? And so when I went to go dispose of it, I got it like fell through the hole and I got poked. And I was like, and then I was like, see, I think I've been saying we need to have
Yeah.
this down here so I can reach it. But they thought I was a crazy person because they were like, it's fine. I was like, but you just saw like I got stuck
Yeah.
by
Yeah.
getting
It's a big
rid of it.
deal. Like,
Yeah.
and like off topic, like medical emergency stuff too. I mean, I've been in offices with the AED. Like, you're gonna get knocked on the head trying to get the AED, and then you're gonna need the AED. Like, so
Oh god.
you know, I mean,
Yeah.
seriously, like all those things that are really, really important
Mhm.
should be at eye level. And I don't mean lowest common denominator, but like shortest common denominator, maybe.
Yeah.
Like it should be at eye level for everybody, and not just for the tallest person there.
The tallest person, right? It's always like that mirror that's hung in a house, and I'm like, "I know who hung this.
Yeah, yeah,
A
yeah,
tall person hung this mirror because I can't even see myself."
yeah, yeah. No, totally, yeah,
It's that
right.
same idea. So as we kind of wrap up, are there any things that or anything in the waste management world, the sharps world that I might not know or didn't ask you about?
I feel like we covered everything. I mean, just being
It is
really,
simple.
it's
I
simple.
feel sad that I haven't learned more about it.
No, it's not sad. Nobody wants to learn about waste. But the important things are making sure you're wearing the right PPE always when you're
Mhm.
dealing with it, when you're dealing with putting it in containers, and then when you're dealing with a full container and putting it in the big box that you have, or when you're tying it up, like you're always PPE up.
Can we define what proper PPE is for that situation?
Well, yes, we can. Yeah. So PPE is a lab coat or a gown that you can take off. It is not long sleeves are great, but like that's not PPE. It has to be something you can
Right.
take off when you're not with patients or not with dirty stuff. It's a mask or a respirator, something that covers all three holes, right? Has to stay on there. It's eye protection that covers all of your eyes. So it's not, there's this whole story about the bottom gap under there. You
Yeah.
really have to make sure
Mhm.
that your eyes are all covered. And it's gloves. And
Yeah.
ideally, if you're dealing with sharps, you probably should have utility gloves. And you
Mhm.
can get really nice ones at like construction stores or catalogs and stuff. It doesn't have to be you know, the kitchen ones that like nobody fits into.
Yeah. And get them with your size because that was always the complaint in the offices that I worked in. I just like definitely asked, I want extra small if it exists in this world. I need
Yeah.
extra small. And people were like, I hate working with these things. I'm like, you only had large. No wonder
Yeah.
you hated
Right.
working with these things. You
Right.
only had large, and I have child size hands. So
Yes.
I was like, this is
Same.
not going to work for me. So yeah,
Yeah.
get the ones that fit your hands for Christ's sake.
Yeah. And they do have them. There's like a million different kinds now.
Yes.
They do not have to be like junky utility gloves, that you're washing your dishes with,
Yes.
which I
Thank you.
don't.
Thank you for
But
that. Well, as we kind of close out, I would love for you to tell us where we can find more from you, learn from you, bring you on as a consultant, email you, websites, whatever it is.
no, this was great. Thank you so much for having me.
Of
Um,
course.
so I own dental office compliance, and the website is doc4ne.com. We used to be for New England, but now we're for the world. No. But yeah, you can do that, or you can, email me, Lisa at doc4ne.com.
Perfect.
Thanks.
Well, I really appreciate you coming on and learning me some things on this and simplifying it for me.
Thank you so much for having me. This was wonderful.
Absolutely. Thank you for listening to season 3 of the Level Up Infection Prevention podcast. Don't forget to follow or connect with the guest. And while you're at it, follow me on Instagram, Level Up Infection Prevention. And check out levelupip.com for more details on all the digital courses and the Infection Control Coordinator's Guidebook.